It's right at the top. It's right at the top, and it's dangerous. So once you've worked out why we're doing this, we have to save patients' lives. We have to improve their care. We then have to have a vision. Where is it going? What is the most dangerous thing, dangerous instrument in healthcare? Is it an endoscope? Is it the surgeon's knife? No, it's very simple. It's the pen. The pen kills more patients every year than any surgical procedure. Usually because of misprescription, unable to read handwriting, it kills more people. So we need to do something about that. One of the problems is, though, everybody is in a rush. We understand that. The world, by its very nature, is getting faster. But that's not the message. I sit there and say to all my doctors, all 7,500 users of the system, I'm not going to promise to save you time. If I can, I will. But for me, the most important thing is saving the patient. Let's save the patient, and if we can save you time, that's great. But the core message is save the patient. We have to, once we've got that vision, we have to then move and make that change. If your marketing team, when you're implementing healthcare, be that telemedicine, be that mHealth, say, I've done a pamphlet, then you tell them to go away and think again. Because as many people there are in this room, there are different ways of thinking. And I've only just named a few here. But doctors in particular have got many different ways of thinking. They may be altruistic. I'm going to do this because it's the right thing to do. They may be the professional type. Well, this is the way we're going globally. This is the way my profession's going. We therefore need to use it. They may be these evidence-based people who like to read all the papers to get an idea that this is the right thing to do. They may do it because their boss says so. But most importantly, it's understanding the what's in it for them, the WIIFM. What is in it for me? Different people need different messages. One message does not fit all. If you say to one type of physician or one type of nurse, we're going to do this because this is good, another one's going to say, well, show me the evidence. If you show all the detailed evidence to the one that just wants to know why we're doing it, they're going to get stuck and they're probably going to say, well, I'm not going to read this. You have to ensure that you give the right message to the right people at the right time. And even when you do, you have people in different states of mind. Some people may not have even heard of what you're trying to do. They have no awareness of what it is. Some may know that you're going to do this. They may have heard of the word telemedicine, but they don't know how it works. How will it work? But the one that's really important for them is, how will it affect me? Not you or you, but me. How does that affect me in my daily life? That's all that matters to the individual at that particular time. Once they get past that point of, okay, I know what it is, I know how it works, and I know how it affects me, well, hopefully we get to the point where they buy into, well, I'll give it a try. Once they've given it a try, and they start realizing that, actually, that message of save the patient was the right message, then hopefully they'll then start taking ownership. Your best salespeople are the peers who believe. Those people who can stand up with their colleagues or sit down over a coffee and say, do you know, I use that new system and it actually is good because of this. I can stand here, you can stand here and preach to people within your organizations, but ultimately the ownership has to come from within. So, looking at the principles of change, we have to understand why we're doing it. We have to create that sense of urgency. Healthcare is dangerous. We have to have a vision. We want to save the patient rather than necessarily save time. We have to manage that change. We have to understand that change is something that doesn't happen overnight, and we have to work at it. And believe you me, it's very hard work. Don't try and do it alone. Have a team. Make sure the people right at the top believe as strongly as you do. But ultimately, once you've got that team, you have to deliver on it. I call this the political campaign. The political campaign says, get that message out there. It's patient safety. Visit the masses. Tell them what you're going to tell them, and then tell them what you told them. Engage them. Tell the right people at the right time. When I was in charge of the National Programme for IT in the UK, we implemented the very first hospital in the national programme in the UK. Unfortunately, we did a big launch to all the hospital, and then it was delayed by 9 months. And unfortunately, that meant about 50% of the staff had either left or moved jobs in a different role. And so we had to do it again. There's nothing wrong with extra communication, but get the timing right. And above all, communicate. Communicate. Communicate some more. And when you think you've communicated enough, you haven't. Get out there and communicate some more. So the really important thing, and my abiding message, is that have that vision. Why are we doing this? Why are we all here? Why are we trying to improve the lives of patients, improve the lives of health professionals? Have that vision, execute on that vision, and then you'll have successful change. Thank you very much. So you'll be pleased to know I've abbreviated.
Please come down here. So I request Gavin to come to the podium. Please. So we have, I think, around 10 minutes to take up questions and comments from the audience. We have covered in this session 4 speakers. Frank spoke about the European Union situation and the activities of Meditel. And then after that, Gavin spoke about the situation in New Zealand and their activities along with the Apollo Group for expanding their health activities. And I spoke a little bit about health policy. Happy me?
230 people watching us right now from 17 different countries. And to show the technology, you can see that right now. So there are more people outside this room watching us than those inside this room watching us. I think this is what we really mean when we say transform healthcare. Thank you.
That's good. Thanks, Ganpati, for your nice comment. And unfortunately, we can't interact with them. So we'll definitely send an apology to them. So you can just get benefited of the discussion that is happening here in the form of a streaming. So any questions and comments from the audience? And lastly, a friend spoke about, Colin, he spoke about the situation in the United Arab Emirates. I liked your last slide, the vision, education, and the change. And I also liked the comment that the doctors are very difficult to change. And also, I think the best person to change is the baby. So good messages from your slides. So we have a good panel of our speakers here. So please do take advantage of them.
Yeah, I have a question.
Yeah.
This is for telemedicine. My name is Sri Hari. Right now, what is the legal point? Let's say a doctor is in a remote, let's say, a call center, and there's a nurse practitioner or a paramedic in a clinic, and the vitals are transmitted there, and doctor prescribes. Is it legal or is it illegal? Should doctor physically be there today?
Yeah, this is the policy issue, so let me take up first, then my colleagues can join in. Unfortunately, in India, we don't have a telemedicine law. And we should not feel ashamed about this. Not many countries have the telemedicine law. Very few countries, even the United States, only few of the states are having the telemedicine law. But at the same time, the business has to happen. So what India government stand today, it's not a policy statement from the health ministry. It is agencies who are supporting telemedicine programs, that is ISRO and IT ministry. As of now, we have the permissible law to exchange the process between the registered medical practitioners at the both ends, the seekers and the givers, both, has to be a registered medical practitioners. It can be from the allopathic doctor, homeopathic, Unani, homeopathic, whatever it is in the Indian law. But at the same time, let me tell you, every day basis, many exchanges are happening between doctor and nurse, and every day, every minute between the doctor and the patient, directly using the mobile phone. So this is happening in the real field. We have not have any incidents of what you call complaint coming from any quarter to stimulate the government to making a law. I must tell you one thing, which is very private, not to be disclosed. So since I'm working with the government, so once when the task force was formed in 2005, so I told the secretary, said, let us also include the telemedicine law. So that time, you must have heard in the newspaper the incident of MMS. There was some incidents of ugly picture put in a mobile phone. So we had the IT Act changed during that time to address that issue. So the gentleman told me, the officer, so let incident happen. Then we'll make a law for that. Go ahead, do activities. So I must place the situation as of now this is. But what I feel personally as a doctor, considering our vast country and lack of resources,